Hi guys, my name is Adam Ford from Adam Songs. Honestly, it was a bit hard to come in and decided to take the vaccine. But when I think of everyone else and I think of the entertainment industry, I just had to decide, you know what, let me just take that chance and make that decision. So I just want to encourage everyone, that for some reason they want things to get back to normalcy, for whatever reason, I think they should take that chance and make that choice also.
Hi everyone, I'm Nadia Farrell Peanut, Head of the Adult Education Division.
Hi, my name is Miss Roach. I'm the Minister Secretary for Ministry of Governance.
Hi, I'm Consuelo Warrington, Administrative Assistant at the Establishment Personnel and Training Department.
Hi, I'm Shamin Thomas from the Ministry of Governance.
Hi, I'm Verna John Baptiste, Senior Clerk, Establishment Personnel and Training Department.
Hi, I'm Emmeline Augustine, Establishment. Just wanted to know that
I got vaccinated.
I got vaxxed.
I got vaccinated. I got vaccinated.
I got vaccinated.
I got vaxxed.
And I encourage you to get vaccinated.
Take the vaccine. Take the vaccine.
I think this is definitely the way so we can make it, so things can go back to normal,
I feel that getting vaccinated is something that's necessary for us to go back to normal like how things were before, and I'm excited to be one of the first people to get a new vaccine.
I'm a little nervous, kind of excited at the same time.
I'm going to take my Covid-19 vaccine.
How do you feel about that?
I'm a little nervous, but I'm excited because I don't like injections.
I don't want to get COVID, so I'm really happy to take the vaccine. And I want everybody else to take the vaccine because it's very important. Get vaccinated.
Good evening, ladies and gentlemen, and thank you for joining us for another comprehensive COVID-19 update. We welcome with us this evening the Chief Medical Officer, Dr. David Johnson, and also here is the Acting Director of Primary Healthcare Services, Dr. Lenora Favrier-Drago. We thank you, the listeners and viewers, for joining us. We thank our media partners, as always, for making this possible. And we begin firstly with the Chief Medical Officer, Dr. David Johnson.
Thank you, Ms. Harry. Let me recognize our Acting Director of Primary Healthcare Services, Dr. Favrier-Drago, and also let me recognize or acknowledge the listening and viewing audience. Good evening, everyone, and Happy New Year. During the last 7 days, we have seen an average of 72 COVID positive cases per day. And as of 8 a.m. today, January 12, 2022, there were 504 active cases, and the deaths remain at 47. We are monitoring the positivity rates of antigen testing in all of our 7 health districts and the A&E department at the Dominica China Friendship Hospital. We are pleased that the COVID-19 positivity rates have decreased significantly in 2 communities where we had seen a cluster of cases over the Christmas holidays. However, we remain concerned and are monitoring closely the situation in another health district where the positivity rate has moved from 6% to, at the end of December 2021, to 17% for the week ending January 8, 2022. This could be as a result of more aggressive testing in that health district, but it's too early to tell. However, we know that many of us have dropped our guards over the Christmas holidays. In Dominica, we are constantly seeking to improve the public health and social measures in responding to COVID-19 pandemic. Exactly 5 months ago, on August 12, 2021 to be exact, the Ministry of Health announced a revised isolation and quarantine protocol for the management of COVID-19 cases. Situation analysis, particularly of the patients admitted to the COVID care complex in Portsmouth and those who were isolated or quarantined at home, has been recently conducted. So we have recently conducted a situation analysis. Our data shows that approximately 70% of the patients who were admitted to the COVID care complex in Portsmouth were either asymptomatic or were admitted with mild to moderate symptoms. These patients seldom develop severe symptoms, which would require hospitalized treatment. So at this juncture, from the evidence we have gathered from COVID-19 situation in Dominica, I am pleased to announce that the Ministry of Health has issued a revised isolation and quarantine protocol which took effect Monday, January 10th, 2022. In the revised isolation and quarantine protocol, we defined a COVID-19 positive case as any patient, whether the person is symptomatic or asymptomatic, with a positive rapid antigen test for SARS-CoV-19, or done by a PCR test, issued by the Ministry of Health and Wellness, or other approved, and I stress other approved facility. Our definition of vaccinated patient has not changed from August last year. At least not just yet, as of today, January 12th. So vaccinated client for us is a client who has shown evidence that he or she has completed both doses of the approved COVID-19 two-dose vaccine regimen or have received a single-dose Johnson & Johnson COVID-19 vaccine. The vaccine has been approved by the Ministry of Health and Wellness, a new health investment, and the World Health Organization. The second dose of the vaccine, obviously is not applicable to Johnson & Johnson vaccine, has been received more than 2 weeks prior to the date of the antigen or PCR test. So under the revised isolation and quarantine protocol, I'll seek to highlight some of the major changes. Vaccinated clients who are asymptomatic will be allowed to isolate at home, and this is not a significant change, or is no change from our August 2021 protocol. However, vaccinated patients who are symptomatic will require an assessment by a health professional approved by the Ministry of Health, to determine the need for admission based on the clinical presentation and findings. Unvaccinated clients who are symptomatic, unvaccinated patients who are asymptomatic will be allowed to isolate at home. A red band will be placed on the wrist, as is currently being done for vaccinated cases. Symptomatic cases will be admitted to the COVID care complex or the Dominica China Friendship Hospital as the case applies. The following categories of positive cases will be referred for admission by the medical professional, whether symptomatic or asymptomatic. So this is new. Individuals who are age 55 years and older with chronic medical condition, or individuals with poorly controlled chronic medical or underlying medical conditions, individuals defined to pose the risk of breaking home isolation protocol if sent home. So all of these individuals described above are eligible for admission after being assessed by a medical professional approved by the Ministry of Health. In the new protocol, it also makes reference to technical guidance for the clinical management of COVID positive cases. Let me say at this juncture that the COVID care complex in Portsmouth and the Dominica China Friendship Hospital continue to provide quality hospitalized care for patients who need to be admitted. All patients who need to be admitted will be admitted. As of 4 p.m. today, January 12th, there were 76 patients receiving care at our COVID care complex in Portsmouth. At this point, I wish to turn my attention to speak a little bit about our COVID-19 vaccination campaign. Our primary goal here in Dominica is to reduce COVID-19 disease burden and the viral transmission, reduce deaths and severe disease due to COVID-19, and protect the health system, as well as to restore social and economic life. As of January 11, that is yesterday, January 11, 2022, the total number of individuals vaccinated with the first dose of COVID-19 vaccine in Dominica stand at 30,953, which accounts for 58.1% of the target population. We vaccinated, as of yesterday, 28,671 persons received are fully vaccinated, which accounts for 53.8% of the target population, or just around 40%, 39.7% of the total general population of persons in Dominica received the 2-dose vaccines. On December 20th, 2021, the booster vaccination was introduced in Dominica. And these booster vaccines we are giving consist of the AstraZeneca, the Pfizer, and the Sinopharm, all 3 of which we have in Dominica. The following priority groups have been identified and approved by the Cabinet of the Commonwealth of Dominica. The 65 years and older, you're eligible. 18 years and older who live in long-term caring settings. 18 years and older with underlying medical condition. 18 years and older who work or live in high-risk setting. All of these priority groups are eligible for booster 6 months after their second dose. However, we are not turning back anyone who show up and request the booster 6 months after the second dose. So as of January 11th, 2022, we administered 1,991 booster in Dominica island-wide. And I'm also pleased to let you know that our digital COVID-19 vaccination certificate is at an advanced stage, and we are expecting to launch it soon. For us in Dominica, we need to ramp up our vaccination coverage to allow for greater normalization of the society and economic activity. I wish someone would tell me of a better proven scientific way to fight COVID-19 pandemic. If there is something better than the vaccine, I really would like to know. But not taking the vaccine is not the better option. Yes, even after getting vaccinated, you need to continue to take precaution to protect yourself, your family, your friends, and your loved ones. We need to take the vaccine and to continue the proven health protocols in the face of the Omicron, which is spreading widely all over the world. Although we have not yet confirmed the presence of the Omicron variant in Dominica, it is found in 14 countries in the Caribbean. So for us in Dominica, we know it is just a matter of time. And just to talk a little bit about the Omicron, we know that different modeling done by the experts show that it is 100 to 500% more transmissible than the original COVID-19 virus. We also know and we see that doubling time is 2 to 3 days and is causing record-breaking numbers of cases in many countries. We also know that over 50 mutations are found on this new variant, twice the number of the Delta. So Omicron is spreading more rapidly because it is better at evading immunity obtained from vaccine. And yes, Omicron is causing 2 to 3 times more infection in vaccinated individuals as compared to what the Delta variant is or was doing. But current data also suggests that persons who receive booster vaccine are less likely to transmit the coronavirus. The experts tell us that until we obtain wide vaccination coverage globally, we are going to remain in danger of new variants. Some will be more transmissible and virulent than the Delta and the Omicron. By all accounts, the evidence has shown that the unvaccinated are more likely to become severely or critically ill, developing respiratory failure, septic shock, getting an infection and getting into septic shock, and multiple organ dysfunction and die. The unvaccinated are more likely to become severely ill or critically ill. It is almost 2 years now that we are fighting COVID-19 pandemic in Dominica. We have some of the most resilient healthcare providers and other frontline workers. Every single day, I receive calls from senior managers, including the one who is joining me here at the podium soon, and frontline staff who say to me, CMO, my staff is exhausted, or Doc, I am really tired. The COVID-19 pandemic is taking a toll on their physical and mental health. But they keep going because we all want to get back to normal. I wish to express my profound gratitude to our healthcare staff and other frontline workers who remain resilient in the war against COVID-19. I urge our citizens to play their part. Those who are eligible, please get vaccinated and to continue to adhere to the health protocols. I thank you for your attention. May God continue to bless our nature island, and good evening.
And our thanks to the Chief Medical Officer, Dr. David Johnson. As Dr. Johnson mentioned, here in Dominica, we stand at 504 active COVID-19 cases, 47 deaths. So far, we've seen about 58% of the population receiving the first dose of the COVID-19 vaccine, while 53.8% is fully vaccinated. The protocols have changed, and of course, once Dr. Drago is done with her presentation, I will give a brief synopsis of those protocols so you can be guided accordingly. But I welcome before that Dr. Drago.
Let me first recognize the presence of the Chief Medical Officer, Dr. Johnson, those in studio with me tonight, ladies and gentlemen of the viewing public, good evening and Happy New Year. This evening, as aforementioned, I will be expounding on the amended protocols for management of COVID-positive cases, and this was instituted by the Ministry of Health, Wellness and New Health Investment from January 10th, 2022. As we have heard time and time again, the management of COVID-19 pandemic is a very fluid one, something our minister says almost every time he speaks. And Dominica by no means has been spared from the many curveballs thrown at us by this very strong-willed and deadly virus. As such, we have had to revisit our guidelines time and time again and our protocols, making adjustments as the need arises. So Dr. Johnson mentioned a few of the protocols which have changed. Not all of them have changed. So I will go ahead and explain those that have changed. The vaccinated cases, if you're asymptomatic, you have absolutely no symptoms, and you come get tested and you are told that you are positive, and the first thing you say is when you're questioned, "Doc, I feel fine. Nothing is wrong with me." Then you are placed with a red band and you are asked to isolate at home. This has not changed and it remains the same. What has changed is that all symptomatic cases will require an assessment by the district medical officer, the family nurse practitioner, the nurse or any other medical professional who is present when you are tested. Why do we want to do that? A lot of times, patients will say that they have absolutely no symptoms, and however, throughout the night or the next morning, you develop symptoms. Usually the triage is done at Portsmouth if you are transferred. Triage of patients will now be done at the testing point. The client can expect to be questioned on the presence of symptoms. So we will ask you, are you feeling sick? The onset of those symptoms, did they start last night? Have you had them for 3 or 4 or 5 days? The severity of your presenting symptoms, and this is done in order that we determine your necessity for admission to the COVID care complex or home isolation. The positive client can also expect to have the oxygen saturation measured, and this is of vital importance since it is an indication of the amount of oxygen traveling through the body at any given time. In a healthy individual, this ranges from 95 to 100%. Now, since we know that COVID-19 affects the lungs, and oxygen is a gas that we take in via the lungs, it is critical that these measurements be made in order to determine whether or not you go home or you go to the COVID care complex. In unvaccinated cases, previously unvaccinated cases, whether or not you were symptomatic, you were admitted to the COVID care complex. With these new amended protocols, asymptomatic cases will be allowed to isolate at home. This is great news for many people who would say, "Doc, I live alone, I have absolutely no symptoms, why do I have to go to Portsmouth?" The same procedure will continue. You will be evaluated. A red band will be placed on your hand, and you will be given instructions for home isolation. If at any time it is determined that you are not well enough to home isolate, you will be admitted to the COVID care complex or the Dominica China Friendship Hospital as the need arises. All patients who are determined fit for home isolation will be provided with a prescription as per the prescribed treatment regimen. So once you have been determined fit to go home and isolate, we don't want you going back out into the public to look for your medication. We will provide you right then and there with the prescription that you need that you can pass on to someone to collect medication on your behalf. The following categories of positive cases, however, will be referred for admission. So this is where we stick by our guns. If you are 55 years and older and you have chronic medical conditions, remember, COVID-19 affects across the board. So it's not just affecting the lungs, it affects the liver, it affects the kidneys, it affects the heart. So if you have comorbid conditions, and by comorbid I mean your diabetes, high blood pressure, cholesterol, poor circulation, you have a history of having a stroke or a heart attack, then you are immediately deemed unfit for home isolation, and we refer you to the COVID care complex for admission. If you have poorly controlled medical conditions, so you are not yet 55, however, you might be a preteen or a teen with diabetes and it is uncontrolled, cerebral palsy, different types of physical ailments, we will refer you to the COVID care complex or Dominica China Friendship Hospital. This one is important. This is one where we see it often. Individuals who are identified to pose the risk of breaking home isolation if they are sent home. So we have, and I must say, amongst our young people, a group that will tell you, Doc, I'm not going to stay home. I feel fine. I don't believe your test, and so nobody can make me stay at my home. If we cannot make you stay at your home, then we will admit you to the COVID care complex. And then there are the individuals who are well behaved and who will stay home. However, they will say, Doc, the situation at home doesn't warrant that I can isolate because it's 6 of us living in a 1-bedroom house. It is unfair to allow the one person with COVID to have the bedroom when everybody else is in the living room, right? So these persons will be admitted based on a social need. Antigen testing continues across the island and is undoubtedly an invaluable tool in the management of COVID-19. How can we treat if we don't test? How can we track our progress if we don't test? The Dominican public has taken advantage of the need to know their status, and this is shown by the vast numbers that we see testing at our sites every day. And just last week, at the stadium, we conducted 3,553 tests, and this is a gargantuan amount. God bless you, great job, can be heard coming from a plethora of our grateful clients on a daily basis. However, many a time the staff at the testing sites are berated, called out of their names, insulted, threatened, and even physically abused by the same clients that we have been working long days and nights to provide care for. Clients go out, they socialize, exhibiting a flagrant disregard for the safety protocols, knowingly exposing themselves to infection, and yet still they come, they get tested, and they refuse to accept a positive result, knowing full well that they were out partying, they were at a pool party, they went out to dinner, they were hanging out with their friends. These are the same ones who are belligerent with the staff, They will deny having been exposed. They won't respond to calls from the Ministry of Health. They will give the wrong address when it's time for pickup. And they will refuse on many occasions to be transferred. You cannot make me go. Nobody can make me leave my house. Such attitudes I know were beneficial in the fight against COVID. And as a matter of fact, they serve as an impediment to this gargantuan task that we as healthcare providers are faced with. On a more positive note, because it can't be all negative, right? Pre-travel PCR testing has undergone a well-needed makeover, and the previously dreaded appointment and results system is now much more appealing to travelers. Where once one would have had to come in person to make an appointment, pay in person, return to receive your results in person, all of this can now be done online through our new appointment booking platform. A simple click on the site pcrbooking.dominica.gov.dm and the results will be received electronically. You can also pay online at epayment.dominica.gov.dm. Going paperless not only saves the environment, but more so allow travelers a smoother, hassle-free pre-travel experience. Allow me this moment to express my profound love, admiration, and gratitude for the hardworking men and women in primary healthcare services. No task is insurmountable. No request is too big for these brave soldiers. And I am sure many of you echo my sentiments. But the greatest demonstration of your gratitude is not only with your beautiful words, and we do appreciate those beautiful words, but more so in following all safety protocols. And like CMO encouraged us shortly, to get vaccinated. God bless Dominica.
And let me express my profound thanks to Dr. Drago. Dr. Drago is not only the acting Director of Primary Healthcare Services, but she also leads the testing team, the antigen testing team. So we thank her for her continuous work and efforts, you and your team. You've been working tirelessly for quite some time now. So Dr. Drago, thank you so very much for that. Again, very quickly, the new protocols: vaccinated asymptomatic patients, you'll be sent home for isolation. Vaccinated symptomatic patients, you'll be assessed. And based on that assessment, it will be determined whether you go home or you're admitted. If you're unvaccinated and asymptomatic, you as well will be sent home. If you're unvaccinated and symptomatic, you will be admitted to one of our care facilities. Whether you're asymptomatic or symptomatic, 55 and over, you will be assessed. If you have a chronic condition, and you'll be admitted. If you have a poorly controlled condition, whatever your age, you'll be admitted. And if you pose a threat to general public, to the safety and welfare of the general public, you will be admitted. Ladies and gentlemen, we urge you to be honest when you are asked those questions during assessment about your symptoms, about your exposure. Now that the protocols have changed slightly, you might think that I can get away with saying that I haven't had symptoms, even if you've been suffering for days. It is not to anybody's benefit if you lie. Ladies and gentlemen, we ask you, if you have been given a red band and you're sent home to isolate, vaccinated or unvaccinated, follow those instructions. Isolate. Don't cover up the band so you can roam the streets. You're not doing yourself a favor. You're not doing anybody else a favor when you do that. If you're not honest with us, how can we care for you? If you're not honest with us in the middle of the night, if something happens, Who's responsible? We have to be responsible for our own actions. So honesty is important. Honesty is important to keep you safe. If you see something, say something. You know your neighbor is not following the guidelines, call the police, call the hotline, and say something. That is also your responsibility. Again, as always, we thank you for joining us. We thank you for your patience. We thank you for your continued cooperation. By way of announcement, tomorrow there will be no testing at the Windsor Park Stadium. That's tomorrow, Thursday. However, testing will resume there on Friday. Tomorrow, no testing at the stadium. In the districts, there will be testing, but there will be no testing at the stadium tomorrow. PCR testing. But it will be resuming on Friday. Thank you to Dr. Johnson. Thank you, Dr. Drago. Thank you, our media partners and the Office of the Prime Minister for hosting us this evening. And thank you to our listening and viewing public. Stay safe. Good evening.